Hi, I'm Christy Nelson, and you're watching 5 Talk Street. There have been some changes to the Affordable Care Act, and 5 Talk Street's Chris Howell has more now. Chris.
Thanks, Christy. I'm here with Gay Humphrey. She is the outreach specialist for the External Affairs team at the Centers for Medicare and Medicaid Services Dallas Regional Office. The team's primary focus is education and enrollment in the health insurance marketplace. Gay, welcome back to 5 Talk Street.
Thank you so much. It's a joy to be here.
All right, glad to have you. Let's get into this. What exactly is the health insurance marketplace?
All right, the marketplace is a way for people who are uninsured or who have insurance available to them that they really can't afford to find health care insurance for the individual and their family.
All right. Now, of course, this is all very important because, as Christy talked about in the opening, there's some recent changes that have been made that folks are probably not likely fully aware of. Let's talk about some of those recent changes that took place in January.
Okay. In January, we did see some of the changes that the Affordable Care Act brought about. The first big one was that people could start receiving health care and having it paid for with their health insurance that they purchased through the marketplace if they had bought that before December 15th. So that's a huge change. But there are also changes to the insurance law. A big one is the fact that an insurance company can no longer deny coverage to someone because of a pre-existing condition. And those are many. Women no longer can be charged more for their health insurance than men, and that was a practice in the past. So those two are really big. Insurance for prescriptions for Medicare beneficiaries. The beneficiaries' copay is decreasing during what we call the donut hole, and so that's a huge one as well. And there can no longer be caps on the amount of coverage that somebody gets through their insurance.
Man, that's good stuff. Now, one of the things that you guys offer at the marketplace is financial assistance for folks who may be having difficulty in getting their plans. Talk a little bit about that. Okay,
I will, because it's a really big part of that. Yeah. You know, Affordable Care Act is what we're saying, and so we realize that health insurance costs can be very staggering, and that's why so many people do not have insurance, is they just cannot afford the premiums. So the system is set up in such a way that there is what we call an advanced premium tax credit for individuals and families whose income falls within, you know, a certain percentile of the federal poverty level. And I'll give you an example in just a minute.
Yes.
But this financial help actually is a way that money will be contributed on their behalf to the insurance company to help pay for their premiums. And there's also some financial assistance for the co-pays, co-insurances that people are charged when they go to the doctor or to the clinic. There's some financial help for folks in that as well. Okay. But it's estimated that about 90% of the people who enroll in the health insurance marketplace will qualify for some kind of financial assistance with their coverage. And just for example, a family of 4 with a household income of $94,200 will qualify for some of this. So this is not just a program for the very low income.
Yes, good point. All right. We are currently in an enrollment period, and let's talk about the deadline for that enrollment period.
Well, it's just around the corner, isn't it? The deadline is March 31st for a person to sign up for health insurance through the marketplace for this enrollment period. And open enrollment does not open again until November 15th. Of this year. So it's really important that people who have been thinking about it and maybe they've looked online and they've kind of nailed it down, but they've not really made that decision. If they want insurance coverage to begin before next year, actually, then they need to go ahead and sign up.
All right, real quick, for the person who enrolls between now and the 31st, when does their coverage begin?
Okay, their coverage is going to begin on May 1st. If a person had enrolled before March 15th, their coverage could begin April 1st, but the 15th through the 31st, then it's delayed a month.
All right, and why is this so important, Gay?
Why is the health insurance so important?
Yes.
Oh, there are so many people who do not have adequate health coverage, and so they don't go to the doctor. So there are many illnesses that people have that could be avoided if they had some preventive care. Preventive care is a big part of the qualified health plans.
Yes.
That's so important, and none of us expect to have an accident. That's why they're called accidents. But we know that anything could happen at any time. So
Absolutely.
Even for those invincible people who never get sick, there may come a time when they're going to really be needing the insurance.
All right, Gay, thank you so much. Really appreciate you coming by and sharing this information with our viewers. I'm sure you'll definitely benefit from that. All right, Christy, back to you.
All right, thanks, Chris. Stay with us. We'll be right back with more of 5 Talk Street.